Hello and welcome to today's class. And for Module 2, we'll be discussing population intervention comparison and outcome, also known as PICO. And there are three learning objectives for today's class. Going to describe what PICO is, the format, and the role that it plays in research. Then we're going to discuss how to interpret PICO for research purposes, and then finally identify a couple of PICO indicators in different research studies. I'm going to use two case studies for the third learning objective. All right, so what is PICO? Before I go into that, you would remember in Module 1, we talked about how you need to come up with a research question when you are doing your literature search or your search for information. And I said that research question is basically the primary thing your research wants to learn, and research question plus data based search gives you a working list of papers to review. But things could happen in the sense that you can have your those working lists can end up being too many results because you searched too broadly, or you may find too few results, and that is because you searched too narrowly. And a way to solve the problems of these two, whether too many results or too few results, is to have a well built question. You need to think through your question very well in order to come up with a question that is really going to help you when you're doing the search. You get a manageable number of results in terms of the papers that you have to go through. So, and that is where PICO comes in. It helps you in constructing a well built up question in order to help you do a good research. So, PICO stands for P is patient or population, I is intervention, C is comparison, and O is outcome. So this is like a general explanation of what PICO is. Some of the question it could be asking is, who are the patients? It could also be asking, the question is, what is the problem? And then you have the question that intervention could be asking is, what do we do to them and what are they exposed to? Comparison is, how do we compare the intervention? Sorry, what do we compare the intervention with? And outcome is, what happens? What is the outcome? I'm going to talk about this in more details. So just in case these questions are not making it clear for you, I'm going to discuss it in details. So why do we need PICO in data management? And so what happens is that, you know, like I said, your research plus your database research is what you that helps you come up with literature. And the reason that you need to even begin to come up with the literature is because your research needs to bring something new to science. That is the whole purpose of doing a research, to come up with a new discovery or to learn something different that we have not learned before. That is, kind of the purpose of research. So your research does help bring something new to science. Now, at your level, this may not really apply. At your level, what you're doing is learning what's going on in research. So this may not kind of apply to you, but regardless, just think about it from that lens, that the reason we do research is to help bring something new to science. So, and to be able to build, bring something new to science, you have to know what has already been known in that area. I talked in module 1 that new knowledge is built off on old knowledge. And so before you can bring something new, you need to know what was known before. Otherwise, you may just end up wasting your time thinking that whatever you're bringing in is novel and is new, only to find out that, you know, thousands of researchers have been asking the same question for the past 15 years. So you wouldn't want to waste your time in that manner. And also, what it does for you is that it helps you know what type of data was collected in those previous research that was done, something that is close to whatever you're doing. And it also helps you in understanding how the data was analyzed, just in case you need to collect the same type of data or similar types of data, or you want to kind of have a look at the what the data analysis was like. If you could do a different data analysis, maybe if you did a different data analysis, you will get a different result, and things like that. So this is some of the information that you get out of having a well-built research question, using PICO. And then another thing that comes out is that what questions did the previous research raise? So one thing that happens in research in general is that while it answers some question, it also brings up new questions, and basically that's why the your new research, what it brings in is sometimes to help answer the questions that previous research asked as a result of their research. So by knowing what questions were asked, then you may, what questions arose from those research, it may help you kind of make a decision whether you want to ask a different question. You want to answer those questions or ask a different question in your research. So ultimately, based off on whatever research that comes out of your database search, you may need to modify your research question. Let's use, for example, when you started your research question, maybe you were kind of on a blank slate, but by the time you've done a good database search, which PICO helps you come up with, then you may end up modifying your research question, whereby you may end up asking a different research question, or you may collect a different data, or you collect the same data that was used before, but you decide to analyze it in a different way. So those are some of the things that PICO does for you. So let's go back again to defining PICO. Remember, we said PICO, who is your patient, what you plan to do on the patient, your comparison, what is the alternative you're considering, what do you accomplish. So these are the different definitions that have been used in trying to explain what PICO is. So now I want to kind of drill into it a little bit to kind of expand on that. So the population, who is your patient or who is your population group? So what you are kind of asking the question is, what is the primary population that I am interested in? You're not going to do a research on everybody. For the most part, you're going to do research in a more narrowed population, or more narrowed sample in this case. But you still, just because it's a sample, I don't know how to say, because I don't know how many of you have taken HSM 215. Just in case you have not taken 215, a sample comes from a population, right? So a sample is a small set of the whole population. For instance, women would be a population, and women living in Louisiana would be a sample out of it, because you don't want to do a research on all the women. You probably don't have enough money to do that. And so you're only doing a research on the women in Louisiana. So that's a sample. Just wanted to get that out of the way. But in this case, when you are asking the question of PICO, your population is not looking at it from the context of population versus sample. It is just looking at it in terms of who are you interested in. So this could be in terms of if you're going broad, you may be asking the question of you're interested in African Americans, but you can also narrow it down, make it more targeted, and so by making it more targeted, you're kind of looking at a subpopulation of a larger population. An example would be African American children living with disabilities. that is a subpopulation. You still have African Americans there, but instead of, let's just for example, dealing with millions of people, you're probably maybe hundreds of millions of people, you're probably dealing with just a million plus, a much smaller sample. But you can even go even smaller by looking at African American children with physical disabilities between the ages of 3 to 17 who live in the South. So you can narrow it down. Your population can be broad or it can be more narrow. But one of the things in deciding how narrow your population is, if it's too narrow, the number of results you're going to get in terms of database search is going to be very narrow. So probably don't go too narrow with it, but also don't go too broad, because if you go too broad, you have the problem of too many results. So, but don't narrow it too much, because if you narrow it too much, then you have the problem of too few results. So that is something to pay attention to. So for intervention, what do you plan on doing for the patient? An example could be a special education program, for instance, in the case of the African American children with disabilities, or you could be doing something outside. Many people kind of, when they hear intervention, they think of community programs and, maybe diabetes management intervention or those sorts of things. In the context of PICO, that is not what we say when we mean intervention. Intervention could be a program, for example, special education program. It could also be uh, uh, what you're experiencing. An example here would be a patient reported perceived discrimination against their children in class participation, whereby the intervention in this case is the trying to find out what the patients, what parents are reporting, or what parents are reporting in terms of their perceived discrimination that is going against their children. That could be what is being measured. So intervention doesn't have to be a program. It could just be an experience you're trying to measure. It could also be trying to test out a research finding in practice. What sometimes happens is that when you do a research is in a controlled environment, everybody is playing a particular role and everybody has been well trained in doing that, and then it happens. Unfortunately, that's not how real life happens. So in a research, you may find one result, one is a result that says this works, but when you take it and try to run it in practice, you find out that actually, no, we need to do something. So that would be an intervention in this case. So for comparison, you could be asking the question is, what alternative are you considering? For example, you have the special education program. You could be comparing it to the regular education program, and you could have, instead of asking parents to report what their perceived discrimination is, you decide to just take the class attendance or get record on class participation, things like that. You could also be comparing, what your different population, how they are experiencing I. For instance, you could say, what is going on with class participation between African American children with disability and white American children with disability, and what is the parents' perception of discrimination, the children experiencing discrimination. So it can actually be a comparison of your P or your I. That's how that could be. You could also be comparing African American children with disability with those who do not have disability, and you could also be comparing in terms of where they live, those who live in the South compared to those who live in the North. So it just basically depends on what it is that you are interested in, but What the comparison is trying to help you know is what is going on with these people or this group versus what is going on with this group, as a way of understanding what is basically going on. It's more like a comparison, really. Well, I'm using the same term, comparison, but I hope you understand what I'm trying to say, in the sense that we want to understand what is happening with in this context by looking at it from the lens of another context. So that is basically what that is doing. And then finally, with outcome, what do you what are you hoping to accomplish? You could go more aspirational. I'm using the word world peace in this case because it's really going aspirational, where you could be looking at how to reduce school dropouts, that happens among children with disabilities. Or you could, do something more simpler, where you could be, looking in terms of how your different population is experiencing your intervention. For instance, in terms of your class participation, you are now that your class participation is your intervention in this case, and you are using it to, compare children with disabilities versus children without disabilities. Or you could be, for all children with disabilities, what you're looking to find out is that for parents who reported perceiving discrimination, did they say they are more likely to withdraw their children from school or not? So those are the kind of results that you can get from your outcome in terms of it. So now let us kind of look at it in real life example. In this case, so we have this question that says, is the adherence to the Mediterranean diet associated with a reduced risk of heart attack? For this research question, the population is adults with heart diseases. Intervention would be the Mediterranean diet, and the Mediterranean diet is, plant-based, and you could be comparing those who are eating regular meal without any special diet, or you could be comparing Mediterranean diets against vegan diets. And then what you could be using to measure whether there's a reduced risk of heart attack. You could be looking in terms of what is the number of times those adults are reporting having a heart attack, or you could be looking at in terms of what is the reduced hospital readmission for those adults with history of heart attack. So you don't necessarily need to have one comparison. You don't necessarily need to have one outcome or even one intervention. Everything basically depends on the research and how that comes out. So I'm going to use another example. At this point, what I want you guys to do is to pause this and read through this abstract. This is an abstract of a study. What I want you guys to do is to attempt to pick out the PICO in this abstract. So this is case study 1. And this is case study 2. This is also the abstract of another research, also attempts to pick out the PICO in it. So you can pause in these both screens and kind of make an attempt to pull out what the PICO is. So I'm just going to go on, but do try before we get into the results. So the result in the PICO for case study 1 is people with disabilities. The intervention is those with hearing aid. The comparison is those with visual impairment. Outcome is perception of discrimination and stigma. In case study 2, population is the U.S. nurses. Intervention is racial minority. The comparison is health white nurses, and the outcome is job satisfaction in an turnout. So I want you guys to compare the result I have here with the result that you have and tell me how you did in that. So that is the end of this class. Do remember to use the Q&A board if you want clarification on anything, and I will respond as quickly as possible. To have a lovely day. Bye.